A complex PCI procedure would be something where you have heavy calcification, tortuosity of the coronary arteries, potentially tandem lesions in the same vessel, requiring multiple assessments on different settings, potentially on the same setting. Anything that involves the high-grade coronary disease, such as left main stem disease or osteal LAD disease, for example, would be complex coronary intervention. And I would also add to that list the previously very vascularized patients, those who've had previous grafts, for example, those who've had previous stents, where there's been issues with the stent, be it deployment, be it undersizing of the stent, would constitute complex coronary intervention. During pre-PCI, the important thing is to really understand the anatomy and potentially the physiology of a coronary lesion. Defining the anatomy is essential because it dictates how you would stent and optimize that stent later on. And for example, using the high-definition IVUS to understand the degree of calcification, the extent of the disease, sizing of the vessel would be quite essential for treating complex PCI cases. But moving on from the pre-PCI to during the procedure, it's also important to really get an understanding of the physiology, the importance of the ischemia driving lesion or vessel. And the use of microcatheters has really revolutionized the way we assess these vessels. So historically, it's been difficult to negotiate tortuous vessels, calcified vessels using standard pressure wires. But with the microcatheter, there's the advantage that we can actually interrogate those lesions much more accurately, much more easily. So in a busy cath lab, having the right tools enables us to interrogate those lesions quickly without adding too much time to the procedure is extremely essential. So in terms of the post-PCI optimization of the stents, one of the important things is to really understand whether what we've done, what looks angiographically a good result, is clinically a good result. And there's increasing evidence to suggest that both the use of IVUS to make sure that the stent is fully deployed, fully apposed, is essential. But more than that, the use of microcatheter-based pressure assessment post-stent deployment is increasingly becoming important. And evidently, there is some data to suggest that there's some clinical benefit from doing so. Like I said, being a busy interventional cardiologist, the important thing that we focus on is really time, but also outcome for the patient. So being able to pick up a tool off the shelf, connect it and use it straight away is exceptionally important. So having that time delay between setting up the device and actually using it to interrogate a coronary lesion or a stent post-implantation is exceptionally important. And I guess the newest technologies, including the high-definition IVUS and the microcatheter-based FFR, is an example of that. Before the invention of these technologies, we would have to calibrate the wire, connect, reconnect. There's associated signal drift as well with traditional wires as well. Whereas with the microcatheter-based FFR, it's essentially as simple as a click and calibrate and use. With regards to the high-definition IVUS, I believe the detail of what we see now is enlightening. We are increasingly learning from this technology about the things that we do within the coronaries. And whilst sometimes we see what looks like a fantastically good angiographic result, actually doing a post-implantation IVUS reveals a great deal. And it may impact on things like post-dilatation, it may impact on coverage of further disease that may be discovered as well. Going back to the pressure microcatheter FFR assessment, one of the biggest advantages of the technology is being able to interrogate tandem lesions within the same vessel without having to remove the wire And I guess the biggest advantage is that we're able to use this over our preferred wire. So I want to be able to use whatever technology is available over the horsework wire that I use on a daily basis. And those technologies allows me to do that. Well, I think in any modern laboratory, the use of microcatheter-based FFR and high-definition IVUS is becoming increasingly important. It's more than just implanting a stent now. It's really understanding that what we have done is good quality and has long-term outcome. And being able to interrogate stents using high-definition IVUS, for example, is essentially quite important for our patients. But taking it further than that, doing an FFR-based study for these stents and working out how well the result is and matching that to the angiography is also becoming essential for the long-term outcome for our patients.